Regarding the clinical anatomy of the scapula, we know that the scapula is, the fractures of the scapula, they're not very common. They're very uncommon because of the safe location of the scapula, because it is located posteriorly. So most of the time, the impact of the injury is from the anterior surface. So obviously there would be rib fractures first, and if the mechanism of the injury is so severe, or the impact of the trauma is so severe that there are fractures of the rib and the blow is then reached to the scapula, or maybe possible the person or the individual was hit from the back, or there was a crash injury, or the victim was crushed over by the vehicle, then there's a possibility that there's a fracture of the scapula. But if there's a fracture of the scapula, remember there would be fractures of ribs as well, and there's not much you can do for the scapular fractures. So there is a possibility that there's a fracture to the glenoid. Then there can be oblique fractures on the upper surface of the glenoid cavity. Then there can be the transverse fractures involving the glenoid and obviously the lateral part of the lateral border of the scapula. So what happens is, like, when there is trauma to that particular part, there would be dislocation of the shoulder joint, and obviously the stability of the shoulder joint would not be maintained, and the patient would have anterior or posterior dislocation of the shoulder joint along with the scapular fractures. So then there can be fracture starting from the glenoid cavity and extending to the suprascapular notch. There is a possibility, if there's a fracture and it's going all the way to the suprascapular notch, then there's a possibility that there's injury to the suprascapular nerve. And then obviously the suprascapular nerve is supplying to the lot of the muscles, and there would be injury of that particular muscles. Okay. Then there is a possibility of the transverse fracture of the scapula extending from the medial to the lateral border, dividing the scapula into the two halves, upper half and the lower half. That's how the scapular fractures can be found. But usually they're very uncommon. And if there is, you can see or you can appreciate a scapular fracture, or there is a tenderness over the back at the scapular portion, then you will also check out for the rib fractures, and then you will suspect that the trauma, severity of the trauma, the impact was hard, or the victim was crushed over, or there was a severe crash injury that resulted in a scapular fracture. So that will lead to the shoulder joint dislocation. And then there are some impingement syndromes, and it's because of the possibility that there are some impingement to the nerves, like the suprascapular nerve, and the patient will have tingling and numbness and paralysis along to the distribution of that particular nerve. And then rotator cuff tendonitis, because we talk about the muscles of the rotator cuff, which are attaching to the scapula. So frozen shoulder, or you can say rotator cuff tear, there's a severe pain over the shoulder joint, and the patient will specifically tell you about that whenever he abducts or rotates the arm, there's a severe excruciating pain, and range of the movement is also limited. So that will indicate about the rotator cuff tear. Especially it's common in the athletes and the people who are involved in extensive sports like the badminton and squash, and most of the sports which are related to the upper limb, right? So there is a possibility that there's a rotator cuff tendonitis or a tear, and the patient will have excruciating pain, which can be treated with the analgesics and a good physiotherapy. And the extensive, fractures can be in between the lateral border and the medial part, or an extensive injury to the scapula. So in today's lecture, we talk about the scapula. We talk about the important clinical points. We also talk about the structures which are attaching to the scapula. Remember, to summarize here, the scapula is a bone which is forming the shoulder girdle along with the clavicle, and scapula is a bone which is, making the axial and the appendicular skeleton to be linked together. And the glenoid cavity of the scapula is responsible for the formation of the shoulder joint and a glenohumeral complex, responsible for the multiple complex mechanisms and the complex movements of the shoulder joint. And you have the spine of the scapula, the acromion of the scapula, you have different fossas and the attachment of the different muscles, which are very, very much important to know. And then you have the fractures of the scapula, which are not very common until unless there is a square chest trauma or square trauma from the back. And then you have some impingement syndromes and rotator cuff tendonitis. So these are all the clinical implications of the scapular fractures. So that's all for today's lecture. Thank you for watching sqadia.com. Keep watching sqadia.com.